We've all been there, where you feel like you're running on fumes. Your eyes are heavy on every Zoom call, and you just are telling yourself, well, this is just stress. Well, I'm busy because I'm working and I'm a mom.
I'm such an ambitious person. I'm like, I'm going to keep going. I'm going to keep reading these studies. I'm going to keep seeing these patients. But I felt like it took me a little bit longer to finish my notes, like to read the email, to like make sense of the words that were in front of my face.
You're a board certified sleep medicine physician, and you don't even know that basically what you have is sleep apnea.
I was reaching for a third cup of coffee in the afternoon, and I was just like, this is normal.
So this episode isn't just about sleep apnea. It's about why brilliant, accomplished ladies, especially in midlife, tend to be so good at ignoring the symptoms as their body is starting to scream at them.
Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Alison Kole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
Hello and welcome to another episode of Sleep is My Waking Passion. I'm your host, Dr. Alison Kole, and today, Dr. Valerie Cacho is returning. Why? Because we're going to be talking about women and sleep health, and specifically women with obstructive sleep apnea. And she is going to actually share her own journey. So if you know that feeling, and I think we've all been there, where you feel like you're running on fumes, you've just, like over caffeinated, your eyes are heavy on every Zoom call, you're waking up in the middle of the night sometimes with your heart racing, you're not quite sure why, and you just are telling yourself, are you listening? Well, this is just stress. Well, I'm busy because I'm working and I'm a mom. This is just how life is. I've just got a lot that I'm juggling. This is what we tell ourselves as ladies, okay? And now I want you to imagine that you're a board-certified sleep medicine physician and you're telling yourself all this stuff and you don't even know that basically what you have is sleep apnea. That is the exact paradox, and that is what Dr. Val is going to share with you today. She is fellowship trained with me. That's right, we trained together. And she spent years diagnosing sleep apnea in her own patients, right, Val? And yet she was ignoring the red flags in her own body. What? It can happen. So this episode isn't just about sleep apnea. It's about why brilliant, accomplished ladies, especially in midlife, tend to be so good at ignoring the symptoms as their body is starting to scream at them. It's about why you can be 98 pounds soaking wet, be a little old lady. Nobody is thinking about sleep apnea in you, and yet you can present with severe sleep apnea. And nobody actually saw it coming, okay? So this is about prioritizing your sleep, understanding that you are not selfish when you do so. It actually may save your heart if you address your underlying sleep disorder that you probably have. So if you've ever thought, I'm too young, I'm too old, I'm too thin, I'm too healthy, I don't need a sleep study, how could that possibly be a problem? Keep listening, because that's what this episode is about. Welcome, Dr. Val, again. You know how much I love you, and I love everything about you. We always talk about sleep apnea as the stereotypical, I'm an overweight, middle-aged man, and I'm snoring all throughout the house, and people tell me I'm gasping, and I'm sleepy all day. That's our typical thing. But we know that sleep apnea doesn't present like that. So I want to start getting into your story a bit. I think let's lead with that, because your story is going to be reminiscent of what women need to hear. So how do women present, and how does that marry with what you experience in your own personal life?
Well, first off, Alison, thank you so much for having me back. And I just want to thank you for all that you're doing for the sleep community and for the world. Honestly, I feel like you've given me a backstage VIP pass to just glimpse all of your success. So I'm so happy to be here. Yes, lots of firsts. So to answer your question, you know what? I think, can we just blame our fellowship? Because we both trained at the VA, which wonderful symptoms of sleep apnea. But guess what?
I want to know what symptoms that you noticed in yourself that also would be symptoms that other ladies should be thinking about. Because you're right, our sleep fellowship, you train at the West LA VA, like what was it? 95% of the people at the VA would be men. Like we got our lady training at All of You Medical Center, I think, or the occasional, female who was coming for their VA care. But that was not the norm by any stretch, for sure.
Yeah, so the symptoms I was having, and again, it was so hard to tell because I was a young mom. I think my daughter was about a year old. I was working at a super busy hospital-based practice. I was the only physician there, and we were really ramping up with sleep studies, doing sleep consults. I want to say probably the first thing now that I think of it as you ask is my productivity slowed down a bit. But I'm such an ambitious person. I'm like, I'm going to keep going. I'm going to keep reading these studies. I'm going to keep seeing these patients. But I felt like it took me a little bit longer to finish my notes, like to read the email, to like make sense of the words that were in front of my face. Another thing that I think was really big, believe it or not, I actually didn't really start drinking coffee until sleep fellowships. I was reaching for a third cup of coffee in the afternoon, and I was just like, this is normal. I get my cup in the morning to get going, a midday one, and an afternoon, that slump that happens, let's just caffeinate right through it. And it's just like, what the hell? Is this real life? I mean, sleep apnea certainly was in my family. My father has snored as long as I know. And I figure, what I did know about sleep apnea in women, it'll probably happen, when I'm 50 or 60 and I've gone through menopause and, we'll call it a day. But I was 36. I was like, what is happening?
Any trouble with your pregnancy that you think may have been sleep apnea related, or were you okay during pregnancy?
You know what? Looking back, and I was at a national sleep conference, and there was a talk all about women in pregnancy with sleep apnea. And I attended that lecture, and I was pretty shocked and scared, to be honest, because I was diagnosed with pregnancy-induced hypertension, which again, sort of runs in my family. I gained some weight. I wasn't the healthiest eater at that time, but I just figured, I think, this just happens when you're a pregnant woman. A lot of weird things happen. And then lo and behold, the research shows, my goodness, if you have, hypertension when you're pregnant. And, I probably was snoring back then. I mean, I don't really know, but I probably should have tested myself. But again, running a busy medical sleep department, I was a medical director there, doing a lot of meetings, seeing a lot of patients, sort of nesting, getting ready to have my first kid. And I was actually writing the book then too. I was editing the book and I was staying up pretty late. So there was a lot of reasons for me to be tired. And honestly, apnea was the last on my list. And yes, every day, all day, I talked about sleep apnea and I didn't even think it could happen to me. So ladies.
Wow. Just to give you a mindset, Val and I are very similar. We're just like fairly average weighted people. Like we're not tiny, but we're not really obese either. We're like run of the mill. And yet here we are, like still could happen. And some of the other symptoms that I think are just worth mentioning because they can impact you. They may have not impacted Val specifically. If you're really having trouble, especially with maintaining sleep, though the literature says that it can be trouble falling asleep, staying asleep. It can be waking up early and then you can't get back to sleep. It can be a whole slew of things. That's a broad topic of insomnia. If you're really struggling with your sleep, and sometimes it's not even true insomnia. You might be able to fall back asleep, but you're just having these disruptions that you can't quite put your finger on. That could be sleep apnea. When you have kids, sometimes, your bladder gets impacted. So you think, oh, I just have to go to the bathroom more times than not. That could be a sign of sleep apnea, believe it or not. And the other thing, too, that a lot of us ladies get that we don't think about, migraines. And so if you're someone who is like constantly waking up with a headache, you might just assume that it's just you're a chronic migraine sufferer. That might be another symptom of sleep apnea in us ladies.
Add to that, Alison.
Yeah, sure.
Wake up with headaches. And you know what I thought it was? I thought I was withdrawing from caffeine. And I thought I just needed more coffee to sort of push through that. Can you believe this?
But it just goes to show we don't know everything. So did you ever have any cardiac symptoms? And I want to really talk about cardiovascular health in us ladies. So if you wouldn't mind sharing if you experience any symptoms, and then also what should the ladies be on the lookout for?
Sort of the x-ray risk when I was pregnant.
You wanted a CTA?
I did. I was like,
oh.
Sure, I don't have a PP. And, she had to call the attending, my physician, and was basically had to calm me down and say, okay, your blood pressure is just high and that's why you're short of breath. Like, you do not have a blood clot. Just as a aside. So, yeah, I think the high blood pressure, definitely for sure. Some shortness of breath. I do work in a cardiology clinic. I rent some space here in California. And you know what? Some of the referrals I get are pretty interesting, right? So it's like a 55-year-old woman who has insomnia, some vivid dreams and palpitations, and does not want to take blood pressure medications. And this story is so interesting because she herself diagnosed her mother with obstructive sleep apnea. And so as I did an initial visit, I'm like, okay, some complications. She's an anxious lady. She's got a lot going on in her life. We start down the cognitive behavioral therapy for insomnia route.
Whoa. And that is aligned with what the literature says. And even mild sleep apnea, guys, like even if your airway is not closing off basically 15 times or more, which puts you starting to get into the moderate category. This is what you'll hear your doctor talk to you about when you're going over results. The bottom line is that even mild sleep apnea can be associated with high blood pressure too. And those palpitations, the problem is that they could be leading to like actual rhythms that, speaking of blood clots, can cause you to have things like strokes and heart failure, which is atrial fibrillation. That's when the signals get all crossed, and then, it's supposed to be a very in sync heart rate that we have. And atrial fibrillation is a problem that we really see associated with sleep apnea quite a bit, as well as the stroke issue, which also gets increased substantially. We know that women can develop obstructive sleep apnea. As we've been talking about, sometimes it's mild, sometimes it's more significant. We were talking about atrial fibrillation and the risk for that and abnormal heart rhythms. What I did want to ask you is, could you talk a little bit about how obstructive sleep apnea, mild may not be mild in the ladies, like what we might see on the sleep study that might tip us off that they're at higher cardiovascular risk despite a, quote, mild diagnosis of sleep apnea?
Right. So I think you're alluding to REM-related sleep apnea, and this is something that we see more oftentimes in women. Sometimes I like to say because women are a little bit smarter, but can happen when our airway partially collapses, our brain wakes us up. But in addition to that, right, we have 4 stages of sleep. There's stage 1, stage 2, stage 3, which is deep sleep. And then there's REM, which is actually its own category on its own. Some people like to lump deep sleep and REM together, but it's actually separate. So sometimes what I see in clinic is women who really don't snore, but they have difficulty staying asleep. They also report very vivid dreams. So during REM, your body is actually paralyzed. It's a free run, right? You're still breathing. So you don't act out your dreams. But guess what? If you have an apnea event because your muscles are more paralyzed, especially the muscles of the upper airway, and you wake up out of REM, you're more likely to remember that. And so hence the vivid dreams. And also some literature does support that women do in fact have more REM-related sleep apnea events, and potentially
you are not kidding around. And believe me, this mirrors exactly what I've seen too, where I almost feel like insane for prescribing someone something. I'm like, sometimes it's that their apnea-hypopnea index, the number of times that your airway is closing off, which is the real kind of purest strict criteria, seems to be like 4 events per hour. But then when I look at things like their respiratory effort-related arousal, so do they get triggered to wake up and their airway still looks mostly open, but now we just have maybe a 1 or 2% drop in oxygen level, and that's triggering them to wake up. And their sleep test is noting that, it's a hard discussion because it's kind of a hard sell. Like, hey, this is elevated, though your AHI looks fine, but you seem to be pretty symptomatic. What do you think about treatment? And I've had some people kind of be self-advocates. They're like, because I'm like, do you really want to do that? I could refer you for this or for that. I can kind of go either way. And they're like, no. I don't think you understand. I feel horrible. And I'm like, you're right. I didn't understand that. And so we treat them, and I'm like, God, am I even going to get this approved through insurance? Like, this is going to be interesting. And then we get them on therapy, and they're like night and day, but on paper, you would have never really known. And I even have talked to other doctors that, are in academics at major academic institutions, and they will poo-poo sometimes the home sleep apnea testing and those RERAs, those respiratory effort-related arousals, is more mild criteria, because they're like, it's going to over-index. It's probably not significant. And one person actually told me that they eliminated it from the reports for one of the home sleep apnea tests. And I sat there and I was sort of like, but I've actually included it, and it has revolutionized my patients' lives. So I'm not even sure we all, no matter academic or you're in private practice or whoever you are, when you're boots on the ground seeing patients, the bottom line is you can go either way with some of these numbers, and it's still debated in sleep medicine. But I think, Val, you are aligned with me in that I'm much more liberal about treating people, because I'm like, the downside is very little. The downside is our intervention didn't do much. okay, then let's call it a day, or let's go with a different option and see maybe it isn't really that very mild sleep apnea that's causing you to have symptoms. Maybe we need to dig further and look for a different explanation. But I think it's, if you can make a difference and you're not even giving someone a pill that could have side effects or anything like that, you could really be, changing a life in a meaningful way. Would you agree? I think we're changing lives every day. And I don't know about you, but now that I sleep well, my world is so much better. I cannot explain it to you.
For sure. I mean, I was reaching for 3 cups of coffee, waking up on headaches, and didn't even know it. So I like to tell patients, I'm in the business of helping you feel better. And that could be on a machine, off a machine, helping you lose weight, helping you see a really good dentist, helping you get an implanted device that moves your tongue out of the way. Like, we're in this together. If you show up, I'll show up, and we'll figure this out. So that's really my motto. I'm here to help people, and it's so rewarding. I love being a sleep doctor.
I know, me too. Speaking of treatment options, you kind of went off the beaten path. So I wanted to know, maybe you can talk a little bit about what you decided to do for your own sleep apnea, because it's not the norm. And I find it so fascinating.
Well, thank you. And I remember we were at a conference together. So Alison and Vince, we were all sleep fellows together. And I was like, guys, I have mild sleep apnea. I'm using a machine, it works, but I also have big tonsils. I've had big tonsils, probably since high school. And my husband actually had his tonsils removed, and it was not a fun experience. And then I've had patients come and tell me, that having tonsillectomy, when you remove tonsils, was worse than pregnancy. It was worse than like kidney stone, having a kidney stone. And I was just like, yeah, that doesn't sound like fun to me. And so even though you 2 board certified sleep doctors said you should just sort of man up, Val, and get them done, I was really hesitant. And then I started working at a dentist office and then learned this full field where definitely things we did not learn in sleep fellowship, where we learned about palate expansion, where we learned about sort of pick ways to open up the airspace without jaw surgery. And I was like, huh. And then looking at my own personal history, when I was younger, I actually had 2 teeth removed on one side to straighten my teeth. But back then, the orthodontist, as wonderful as they were, didn't really think about airway. And then since that time, I had braces again. And then I was just like, okay, my teeth are slanted. That's just going to happen. And then there's another one of your guests, Dr. Meredith Broderick, who shared about her MARPE story, which is basically palate expansion. And I was like, I looked at the research and I was like, not a lot of people in their 30s or 40s are doing this. I don't know. Seems on the fringes. Talked to probably 3 or 4 orthodontists and then met Dr. Audrey Yoon, who is phenomenal. And I understand she was on your podcast as well. So I'm excited for her talk. And really for me, it was about getting my teeth straightened again. And at the same time, if there was a sliver of chance where I didn't have to use my machine anymore, let's do it. So I did get it done. It's been about 1.5 years now. I'm still in the works. You can still see some gaps here, removing some teeth or actually opening up some space for me to have teeth implanted. But I can tell you, along that journey, it's really hard to eat when you have this stainless steel device drilled into your upper palate. And so I think that sort of set me off on a little bit more of a health journey where I was a little bit more mindful about what I was eating. I had to really slow down. And so that actually helped me lose weight. So I've lost, I think, in the past 2 years now, about 20 pounds. And so my repeat sleep studies have been, in quotes, normal, but they are home sleep apnea tests. They actually haven't gone to lab. So yeah, that's where I'm at right now. Maybe one day I'll have my tonsils removed, but I think I'm okay.
If you don't have sleep apnea and you're sleeping better and you're going through this whole journey, like, you're good. In fact, what I would argue is that Vince and I were like, we didn't know anything else. We had not heard of palate expansion as something that was really talked about. We had heard of what we call maxillomandibular advancement surgery. That's something we don't talk a lot about, but they basically break your bottom jaw and like kind of reset it so that it's in a better, more optimal position. It works, but you are sipping through with your through a straw with your jaw wired shut. So if you were working and trying to do all of that, that is extremely challenging, especially in our profession where we actually have to communicate with people. We can't be like mumbling the whole time. That would be a very difficult patient-doctor interaction. I could tell you that. So it's highly possible that we were wrong, right? Because we don't typically do that in adults. Yes, you're right. It is very painful. And sometimes, honestly, like, people will go and they'll cut out the uvula and they'll do a lot more than just remove the tonsillar tissue. And we call that a UPPP. And the data's not great for a lot of that stuff. So it's like one of those things where I joke that I've counted on like one hand people I've referred to get tonsils removed. And usually the ones are significant sleep apnea, can't tolerate a CPAP. They're like so giant that they're practically touching. Typically that's in a younger population in like the 20s. But again, we've been practicing for a very long time now. And it's one hand, like it's not very many people because the data's not there. And you're right. It's like I had one guy do a UPPP, decided that's what he wanted to do. And I will never forget him coming back to me. He's like, he just did not remember that I mentioned to him very specifically how uncomfortable it was going to be. And he chose to do it over Christmas. And he was mad because he was like, thanks, because I had a crappy Christmas. I'm like, whoa. I warned you. You chose that you couldn't take time off of work, that you needed to do it over a holiday. And yes, everybody else enjoyed a lovely meal, but he did not and could not. And it is no joke. So it's very painful for sure.
What it comes down to is there's no guarantees, right? There's a lot of folks that do really well on CPAP, right? And there's a lot of folks who can do really well on mandibular advancement devices. But what I see now, and especially the younger, maybe 20 to 30-year-olds, they don't really want to have to be on a machine for forever and ever, right?
Right.
More aware. And they really want to figure out what is that underlying cause. And then they say, the problem with this is just things that sleep medicine physician, because I'm not fully in menopause yet, but one day, I may still need it. So
that is bringing up a huge point that, especially for us ladies too, we can be at risk for premenopause. And yes, it's true that risk may be lower, but it goes up. It's like perimenopause. I saw another chart where then it really angles up. And we essentially, then it becomes a risk that's very much aligned with what men are for their whole life. So and it goes to show, I think, the chronicity of sleep apnea too, and that it can get better, but then it can come back. So if you want to label that relapse, sure, we could use that term. And it is something that's sort of chronically with you that can have chronic long-term implications. I want to finish with talking about the Asian population. I've been becoming more aware of the fact that I'm getting a lot more Asian patients doing telemedicine visits with me. And it warms my heart as a half Korean girl. And this, as an Asian woman yourself, the bottom line is that it's just, I don't feel like it's really emphasized or talked about enough in Asian culture and not recognized nearly enough. I think there's a lot of poo-pooing of symptomatology in Asians because a lot of us aren't necessarily obese or that traditional standard kind of person. Do you want to talk a little bit about why Asians may be at increased risk for sleep apnea despite having a, quote, normal body mass index or even having a low body mass index?
And the simple way I like to explain it is that Asian folks, we're just a little bit more compact. So what does that mean? We have like smaller mandibles, maxillary can be more shallow. There's something called the thyromental angle, which is the thyroid notch here up until here. And sometimes that's shorter. So everything is just a little bit closer together. And when that happens, right, if your craniofacial structure is a little bit more smaller, think about how much space the tongue has. What's going on with the soft palate? And there's these folks, women and men, who are underweight. Now, some people with BMIs of 17, if you have pretty severe sleep apnea. And again, they don't always come to me with the snoring and gasping. It's, I've had a stroke or I've had a second stroke. And now my neurologist wants to make sure that it's not sleep apnea. And lo and behold, you can have severe sleep apnea. Cutest little ladies, but they're really small chins and jaws. That's pretty much it. Also aging too. So age certainly plays a role.
That is so important, okay? So if you're Asian and you're listening to this, just know that if your sleep is not great, you can't put your finger on it, you're having some symptoms, get it checked out. We've talked all about it. It's very benign what we do. And you either come for an in-laboratory study or you do a home test to start. And if it's normal, we can always then make an argument to get you in the lab. Because ultimately, a lab test, a polysomnogram, is the gold standard. So I think you and I try to aim for that, but often we can detect it just by doing a quick home test. And that's so easy to do. Send you a quick kit, you sleep with it overnight. I just diagnosed someone who's older now with his and kind of waking up and having panic attacks. And he even to the point where he woke up and he went to the ER because of the panic attack. And they were like, your heart's actually right. It's going to, number one, we're going to be worried about your heart, especially in your 80s. He's good. It's not his heart. So what else is it? Oh yeah, it's sleep apnea. It was sleep apnea. And again, you looking at them, you'd never know. But based on what you're saying, right? Remember, it's an anatomic issue, meaning we're just built to be tinier. And that's okay. God loves us all. But it means our airways may be more vulnerable. Where's the culture going in Asian culture in terms of recognizing sleep apnea or just recognizing the importance of sleep? Because one of the things I did do for another presentation, just looking at chronic sleep deprivation, is look at some trials that have been analyzing data from Samsung, or I don't remember exactly the brand, but it was just using data that we have from commercial products and looking at how much sleep people are getting. And the leaders in sleep deprivation are definitely Asian countries. So I don't know what you think about or if you have any insights into the culture of various Asian communities regarding sleep.
Well, I can speak to, just sort of data from Hawaii. The CDC has looked at states in particular and looked at, how many people are getting adequate sleep. And they rate that on 7 hours or greater. Adequate sleep is at least 7 hours or greater. And Hawaii is sort of almost leading the nation in adequate sleep. And it's interesting because I didn't think too much of it being of people of Asian descent. I was just thinking Hawaii is a very expensive place to live. A lot of people that I work with have 2 or 3 jobs. But also a lot of folks there are immigrants, right? And there's a little bit different immigrant mentality where, work and productivity are very much prized. And if you're a hard worker, right, you should become a doctor, a lawyer, engineer. And fitness, those specialties maybe don't sleep very much too. And so I think that's really fascinating how there are companies taking a look at data for Asian populations and how much.
Yeah, it was literally looking at all these different countries, and then they're like, oh wait, who's the most sleep deprived? And I was like, whoa. I mean, I've always, having come from an immigrant household, sleep was not prioritized in my home at all. And I definitely have fallen prey to being I would say in pulmonary fellowship, I will sleep when I'm dead. I'm not worried about how much sleep I get. And I never slept anyway. It was ridiculous. I probably lived on 5-6 hours of sleep if it was a good night. Most of my weeks would be 5 or 6 hours, with maybe the occasional I'm now crashed and gotten more sleep. And I was so good at not sleeping. I was a rock star. And now in hindsight, I'm it probably contributed to me imploding and feeling so insane when it was chronic over years and years and years. And I don't like to live my life with regrets, but if I had to go back, I would be curious to see if I had a different attitude about sleep. What could I have accomplished with that? Would that have shaped my personality in a more positive way in terms of being maybe a little bit more resilient than I assumed I am? Because when you are chronically sleep deprived, I know it's nothing to do with the topic we're talking about, but fact that when we are chronically sleep deprived, one of the worst or one of the worst abilities to be self-reflective occurs during that stage, meaning I am not aware of just how dysfunctional I am. And that's been proven. And so I'm man, I was walking around thinking I was tough. And meanwhile, I'm you probably would have had a different outlook and maybe even be smarter than you are today if you actually prioritized your sleep. I don't know.
To answer your question, I'm going to give you a little bit of a long-winded answer. So when you know better, you do better, right? So in medical school, we would just pull all-nighters. I remember almost me and some of my friends were priding ourselves that we got to stay up all night, and then we went to the cafeteria, got some food, and then took our test. But guess what? When I was taking my test, I was falling asleep. So how good was I actually doing staying up all night, falling asleep during my exams? Looking back, I'm that's just so ridiculous. Why did young Val do that? Come on now. But, and I'm so glad that you have this platform and that we talk about this and people who look like us, because there are young Alisons and young Vals out there who are hearing our voices and hearing our words and learning from us. And so I do think the tide is shifting. I don't think it's shifted as much as probably I would have liked, but I think we're getting there and we're making moves. And just the fact that we're showing up, sharing our stories on how, ladies, you don't have to feel this way. Tired, honestly, I feel is so optimal because there's so many things you can do about it, especially if you have an underlying obstructive sleep apnea. And don't just shrug everything off to, I just have so much on my plate. Because guess what we all do? And if you talk to your friends, they're all going to be tired too. So go see a board certified sleep physician, go talk to your doctor, advocate for yourself. I can't tell you how many people I've talked to who their own doctor says, you know what, just lose a couple of pounds, and maybe in the fall, if you're still having symptoms for sleep apnea, do that stuff. That was yesterday. I was talking to a woman who was trying to lose weight, and the doctor said, go talk to Dr. Cacho, but you probably don't need a study until, let's just say, September. And I'm like, don't wait, right? Like, if you get better sleep, guess what? It's going to be easier for you to lose weight. Your hormones and metabolism, your cortisol, your blood sugar. Guess what? You have more energy. It's so much easier to do things if you have more energy. It's like, why would you wait until September? I don't understand that concept whatsoever.
Yes. I mean, so thank you for that. And thank you, by the way, Dr. Val, for being so vulnerable, sharing your story, admitting that we don't have all the answers either. And sometimes we're our own worst critic, are self-reflecting. We're able to tell other people what to do. But when we look at ourselves, we're like, duh, like it's right there in front of you. And we don't even think it could be happening to us. So for anyone listening, sleep is not a luxury. It should be your right. We know it's a vital sign. It's an indicator of something else going on if you are not sleeping well. Rather than waiting for that to be the last thing you mention to your doctor as their hand is on the door and your visit is ending, make it a priority, especially if you have those comorbidities, those high blood pressure, diabetes, atrial fibrillation, whatever it may be, risk factors for accelerated heart disease or strokes, like high cholesterol, for example. Have that conversation sooner rather than later. Sleep testing is very benign. Our treatments are really, I think, quite benign, and they may positively impact your entire life. I think we can all agree on that. Dr. Val, you have an amazing YouTube channel. What do you want to leave? You're going to use the rest of the time to have your parting words. Where can people find you? What do you want them to be paying attention to with what you're doing and your advocacy work? Take it away.
Thank you so much, Alison. So I have a YouTube channel, and it's all about women's sleep health and whole living. It's called Sleepforia, like euphoria and sleep just smushed together. And I talk about all things women's sleep. So I talk about sleep apnea. I talk about hormones. I talk about supplements, sort of. I talk about headaches, just all the things that you wish your doctor told you. Guess what? I'm here to tell you all those things about women's sleep health. So come check it out, completely free on YouTube. And then I have a free community on School. School is an app, and you can check it out, where I put really good educational posts about women's sleep health. So hope to see you ladies there. And thanks so much for listening. And as always, Alison, thanks for having me as your guest.
Of course, babe.
Here with you. Love you.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.